Hey everyone, welcome back to my channel. So today we are learning about 9 signs of liver damage. The liver is an important organ found on the right side of the abdomen, beneath the rib cage. It is involved in the metabolism of food, drugs, and chemicals, the removal of waste products and toxins, and the synthesis of vital proteins. It also filters blood from the gastrointestinal tract. This organ is remarkably capable of compensating for damage. However, chronic liver injury might eventually result in liver failure if it is not addressed. According to Cleveland Clinic, your liver plays such a large role in your overall health that when it's sick, it affects you in all kinds of ways. But you won't always feel the effects of liver disease until it's already advanced. To protect your liver, it's important to be aware of the kinds of things that can harm it and try to avoid those things. Keeping up with your regular healthcare checkups can also help catch liver disease sooner rather than later. Excessive alcohol use, some drugs, viral infections, autoimmune or hereditary diseases are among the common causes of liver impairment. Here are top signs of liver damage. Sign number 1. Altered appetite patterns. A damaged liver can slow down the production of bile and have trouble processing fatty meals because it is unable to properly metabolize the fats and proteins included in diet. When liver damage gets severe or chronic, the blood vessels in the stomach and esophagus may enlarge and cause bleeding, which is a medical emergency. Symptoms of chronic liver impairment might also include nausea, vomiting, and an aversion to high-fat and high-protein foods. 2. Swollen abdomen. A damaged liver can renew itself or compensate, but it can still vary in size and shape. These changes may cause an enlarged liver, which in turn may cause the abdomen to grow. Ascites, or abdominal swelling, can also result from cirrhosis or advanced liver disease. The cause of this swelling is a drop in blood proteins, which causes fluid to escape blood vessels and build up in the belly and other body cavities. Increased pressure in the vein that transports blood from the digestive organs to the liver can also result in ascites. 3. Skin transformations. Hormonal imbalances brought on by liver impairment have the potential to expand tiny blood vessels and result in spider veins. The face and chest are where these veins are most visible. Furthermore, blotchy redness on the skin of the feet, hands, and face is also prevalent. This is usually caused by vitamin shortages, hormone imbalances, or increased pressure within the vascular system. The skin may turn yellow due to jaundice in more serious liver damage patients. This happens when bilirubin, a waste product, builds up rather than the liver metabolizing it. 4. Shifts in bowel habits. Digestion can be adversely affected by liver dysfunction, and the body may try to get rid of extra toxins through the bowels. Diarrhea or constipation may result from this. The liver may not be able to generate and digest bile or bilirubin, which are the substances that give stool its brown hue, in more severe stages of liver impairment. As a result, the stool could seem lighter than usual. 5. Persistent fatigue and trouble focusing. Because the liver must work harder to perform its many tasks when it is damaged, the delayed detoxification process can cause fatigue or make it harder to focus. In addition to difficulty metabolizing meals and absorbing the necessary nutrients to sustain mental clarity and general functionality, a sluggish liver can also cause problems. 6. Unusual bruising or bleeding. The synthesis of proteins that support blood coagulation is mostly dependent on the liver. Increased bleeding or bruises occur from the liver's inability to perform this function when injured. When new blood vessels grow around an injured organ, complications may result. These arteries, which normally form in the stomach and esophagus, begin to enlarge and are prone to rupturing, which increases the risk of serious bleeding and is made worse by a reduction in blood clotting factors. 7. Elevated blood pressure. Blood flow is impeded by liver impairment because of tissue damage and scarring. Portal hypertension is the term for the condition caused by this elevated pressure in the blood arteries around the liver. In an attempt to overcome the resistance, the body creates new blood vessels to make up for the reduced blood flow. These recently developed veins, however, can occasionally bleed or burst, posing a serious risk to health. 8. Variations in urine. A waste product called bilirubin can build up in the blood when the liver finds it difficult to break down and remove. The kidneys then eliminate this accumulation, which frequently leaves urine with a dark or tea-colored tint. If the color of your pee becomes darker, it may be a sign of a more serious liver issue that needs to be treated right away. In the event that you encounter this symptom, remain alert and put your health first by getting help right away. 9. Puffiness in legs or ankles. Ankle and leg swelling can result from liver disease, which is frequently brought on by a lack of blood protein that permits fluid to seep into the tissues. Because gravity pulls the fluid downhill, the legs and ankles are especially prone to this buildup. According to Cleveland Clinic, liver disease can be reversed in the early stages if you and your healthcare team are able to remove or manage the cause effectively. This depends on the cause and how treatable it is. Once you have cirrhosis, you can't undo the scarring that's already been done, but you may be able to prevent further damage or slow it down. Chronic liver failure isn't reversible, though it can still take years to progress. If you find this video helpful, give it a thumbs up and share it with your loved ones. Subscribe and comment below. For more videos like this, hit the subscribe button and turn on the notification bell. Thank you for watching.